Hello everyone, welcome back on Meds. I'm your host, Mr. Meds, aka King Meds, Nkosi Amakhambi, and Bonaniboti Azaneza. So today's video will be continuing with our talk about NSAIDs. I already introduced NSAIDs on my aspirin video. I told you what NSAIDs are and which other drugs are NSAIDs. So today we're going to continue with our talk about NSAIDs, and we'll be focusing on ibuprofen today. I'm sure most of you have used ibuprofen in your life, or some of you are still using ibuprofen in your lives. Ibuprofen is actually one of the most common anti-inflammatory you can get over the counter. If it wasn't for the restrictions that are imposed on ibuprofen, I think ibuprofen would be the best-selling anti-inflammatory in the country. But now, because of the restrictions that ibuprofen has, it is actually not the best-selling anti-inflammatory that goes to aspirin, because aspirin is less restricted compared to ibuprofen. As I said, aspirin, you can buy it in your retail shop, in your garage, or in any supermarket for that matter. Whereas ibuprofen, you can only get it over the counter, only at the pharmacy over the counter without a prescription. So that means ibuprofen is a bit more restricted compared to NSAID, and that makes it less common compared to aspirin. If you ask me why, I don't know, because in my opinion, ibuprofen is better and safer compared to aspirin. Aspirin is one of the most dangerous anti-inflammatories you can find. It is more irritating to your stomach. It is more other contraindication compared to ibuprofen. But you can buy aspirin in any retail without a prescription. You can buy it anywhere, in fact. Whereas ibuprofen is only over the counter and is restricted. I don't know why this is the case. When I said ibuprofen is better than aspirin, I mean in a side effect profile. So aspirin is way more has way more contraindication and side effects compared to ibuprofen. Ibuprofen has less side effects, and when it comes to the anti-inflammatory and the pain relieving properties, ibuprofen is better compared to aspirin. When it comes to ibuprofen, I think it is actually one of the most affordable anti-inflammatories, because you can buy like 30 tablets over the counter with 20 rands. There are some that cost about 20 rands, 30 tablets over the counter. So it's one of the quite affordable anti-inflammatories in the country. Ibuprofen is more common than you think. It is mostly found in most common cold and flu combination over the counter, which makes sense. It helps for fever, pain, and inflammation, which is one of the cold and flu symptoms you probably would have when you have cold and flu. Ibuprofen is also found in combination with paracetamol and other molecules over the counter for relief of pain and inflammation. And as I work in the dispensary, so most of the time you sell a lot of ibuprofen containing products, because there's quite a lot of them in over the counter, especially when it comes to pain, inflammation, and fever. Then that's always one of the go-to products is a product that contain ibuprofen. When it comes to indication, ibuprofen is indicated for pain, inflammation, and fever in South Africa. When it comes to pain, it is actually indicated for any type of pain. It can be a migraine, a headache, your general body pain, your gout pain, your arthritis pain. Ibuprofen is indicated for those kind of pain. Your period pains can be used for any of those kind of pains. Fever and inflammation, that's why I get it in most common colds and flu combination. Then there is also one other indication for ibuprofen. It's called patent ductus arteriosus. That I will explain a bit later when I'm talking about the ibuprofen injection. We'll talk about that a bit later. Although ibuprofen is one of the better anti-inflammatories to use, as I said, it is better compared to aspirin, but it is not totally safe to use. So just want to quickly discuss the contraindication or who should not use ibuprofen. So let's start with people that are allergic to ibuprofen. So that is a basic one. If you know that you're allergic to ibuprofen or any other anti-inflammatory, you should stay away from ibuprofen. Like any other anti-inflammatories, people with gastric ulcer or has history of gastric ulcer should avoid taking ibuprofen, because ibuprofen can reopen the ulcers if you had ulcers in the past, and then if maybe you currently have ulcers, then it can make it worse, make the ulceration even worse. So that's what I mean. If you have history of ulcers or you have ulcers, you should avoid ibuprofen. The other group of people that should avoid ibuprofen is people with renal or kidney dysfunction. As I said, like any other anti-inflammatories, ibuprofen can decrease kidney function. So generally, people with renal function or kidney function problems should avoid ibuprofen completely. The other group of people that should not use ibuprofen is people that are already on anti-inflammatories, especially the population of people that have osteoarthritis, arthritis, gout, that are already on chronic anti-inflammatories. They should avoid taking ibuprofen. That is because it is not advised that you take 2 anti-inflammatories at the same time, because if you take more than 1 anti-inflammatory, then you're increasing the chances of having side effects. Then the other group of people that should not use ibuprofen is people that are already on blood thinners like aspirin and warfarin. That is because ibuprofen can enhance the blood thinning effect of of blood thinners like your aspirin and warfarin. That means if you take you're already on aspirin and you take ibuprofen, then your blood would be more thinner than when you're taking aspirin on its own. And that is usually a problem, because once you bleed and your blood is too thin, then it's usually very difficult to stop it, to stop the bleeding, and you can bleed to death. It's the same thing with warfarin as well. It can also make can also cause blood to be too thin. That's why most of the time you find out that people that are on warfarin are told not to use any anti-inflammatories for that matter. And then the other issue is that because ibuprofen is also an anti-inflammatory, it can open or cause ulceration in your gastric lining in your stomach, and that is a problem, because if you bleed and your blood is too thin, it's usually very difficult to stop that bleeding. The other group of people that should avoid ibuprofen is people that are pregnant, especially if you're already in your 3rd trimester, because ibuprofen, like any other anti-inflammatory, it can prolong pregnancy. Or the other issue is that it can cause premature closure of the arterial ductus in an unborn child, leading to complications. You don't want that. So that's why they said on the 3rd trimester you should avoid any kind of anti-inflammatory unless prescribed by an authorized prescriber. Yeah. The people that are already on a late stage of heart failure and liver function should avoid ibuprofen. That's because if you have heart failure already, you retain water. So ibuprofen, because it decreases the renal function, it can cause you to retain more water, then further leading to your to complications. And then when it comes to liver, as you know, most of the drugs are actually metabolized by the liver, so ibuprofen is one of them. So if the liver is not working properly, then that could be a problem. One group of people that I almost forgot about is people with high blood pressure. It's not really totally contraindicated, but when you use it, you must use it with caution, especially if your blood pressure is not controlled. That is because, as I explained above, when it comes to people with renal function, ibuprofen actually can decrease the renal function of an individual. That leads to blood pressure rising up or getting out of control if you're going to be using ibuprofen for the longest time. So if you use it, then you must use it for a shorter duration as possible, and you must make sure that your blood pressure is already under control. One more group of people that should avoid ibuprofen, not avoid, but use with caution, is children that are suspected to have flu or chickenpox due to the chances of developing the Reye syndrome. I've already discussed the Reye syndrome on the aspirin video. So it's the same thing with aspirin. There's just a fear that children who use ibuprofen can develop Reye syndrome. But with this one, with ibuprofen, it is actually the chances, when it comes to ibuprofen, chances of the child developing Reye syndrome are very low when compared to aspirin. But yeah, it is, the chances are also there, but quite lower compared to those of aspirin. And then the last group of people that should use ibuprofen with caution is those that are already asthmatic. That is the same when it comes to aspirin. The most of the NSAIDs can increase the chances of you getting more severe asthmatic attacks. So it's the same thing with ibuprofen. I would say use it with caution other than not using it, but use it with caution because, yeah, this one is quite a tricky one. It's not the same as with aspirin. It's just in between. Some people get them, some don't. If you get them more frequently, if you use ibuprofen and you get more attacks, then you should stop it. And then there are those that do not experience such things. When it comes to who can use ibuprofen, it's easy. Anyone that I didn't mention in the above contraindication can use ibuprofen. So yeah, it's basically that straightforward. If I did not mention anything about you about any of your population above, then you are free to use ibuprofen. But as I said, it is used for pain, inflammation, and fever, for any kind of pain, inflammation, and fever. Now let's move into dosing. When it comes to dosing, ibuprofen dosing is quite complicated because it has many uses. As I said, there are quite a lot of uses when it comes to ibuprofen dosing. But the lowest dose possible for ibuprofen should be used, and it should be taken after meals for a duration not longer than 10 days. That's how it is indicated for acute indication, not for chronic, obviously. That is for acute indication. So the daily dose of ibuprofen range between 1,200 milligrams to 2,400 milligrams a day in 3 to 4 divided doses. So I'll just talk about the available doses in the country of ibuprofen and how to take them. So you basically get about 3 to 4 doses that are available in the country, but I'm familiar with the other 3. So there is 200 milligrams, there is 400 milligrams, and there is 600 milligrams. Apparently, I've never seen 600 milligrams. And then there is 800 milligrams. So let's start with 200 milligrams. So 200 milligrams is available over the counter. You can buy 200 milligrams over the counter. When it comes to 200 milligrams, you can take 1 to 3 tablets, 6 to 8 hourly. That is basically 3 to 4 times a day after meals for not more than 10 consecutive days. So that basically is 3 to 4 doses a day, not more than 10 consecutive days. And when it comes to 400 milligrams, then you can use 1 to 2 tablets 3 to 4 times a day. That is 6 to 8 hourly a day after meals for not more than 10 consecutive days. When it comes to 400 milligrams, it will depend how many tablets you're taking. If you're taking 1 tablet, then you can take it up to 4 times a day, which is 6 hourly after meals. So that basically not more than 4 doses a day. And then when it comes to, if you're taking 2 tablets of the 400 milligrams, then you can not take it more than 3 times a day. So that is going to be 2 tablets every 8 hours after meals, not more than 3 doses a day. And then 600 milligrams, I would assume that you can't take more than 4 doses a day. It's going to be 1 tablet 6 to 8 hourly after meals, not more than 10 days after meals, so not more than 4 doses a day. That's how I think 400 you can take 600 milligrams. I've never seen it in practice. I don't know if you can get it over the counter or it's only on prescriptions, but the first 200 milligrams and 400 milligrams can be bought over the counter without a prescription. And then there is 800 milligrams. 800 milligrams, I've seen it in practice, but it is used more for chronic conditions. So when it comes to 800 milligrams, it's also a retard tablet. What does retard mean? Exactly what you think. It means slow. So it's a slow release formulation that can be taken once a day, once or twice a day, actually, depending on the severity of pain. So when it comes to the retard, it's nice that you take it less frequently. So it's better on your tummy as well, less side effects compared to the one that you take more frequently, although it is quite expensive, but its side effect profile is a bit lesser than the normal ibuprofen that you take more frequently. So the retard can be taken 1 or twice daily, or not more than 3 tablets a day. As I said, the maximum dose of ibuprofen is 2,400 milligrams. So if you take about 3 tablets, that is basically 2,400 milligrams. So you can't exceed 3 tablets once a day, but in 2 divided doses. The 800 milligrams can be used for more of like chronic conditions, and then we can be taken for chronic conditions. And then the 800 milligrams is only available on prescription because it's a Schedule 3, then you can't get it over the counter like any other ibuprofen. It's only available on prescription. Now, when it comes to children, ibuprofen dosing in children, ibuprofen is indicated for pain, inflammation, and fever in children over the age of 1. For over the age of 1, you can buy ibuprofen over the counter without a prescription. But if the child is less than 1 year old, then it requires a script from an authorized prescriber. They can also take it, as I said, but not on, it has to be prescribed by an authorized prescriber. Over the age of 1, you can buy it without a prescription. There's no need for a prescription, really. But when it comes to dosing, the dosing when it comes to ibuprofen syrup, you'll see it on the package insert. They will tell you how to take the syrup based on the weight or age. Then, yeah, the same way with adults, it can only be taken into 3 doses a day. After meals as well, for a duration not longer than 10 days. It's better to do the shorter duration as possible. If you can do it for 1 day, that's perfect. Do 1 day, 2 days, fine, but try not to use it use it more frequently, as it can have the same side effect that I've already discussed about. It can cause ulcers in children. I've seen children with ulcers. So it's better to not use it as more frequent, or as more frequent as possible. Try to reduce the duration to be short as possible when it comes to children. When it comes to breastfeeding and pregnancy, as I said, in pregnancy, it's totally contraindicated unless prescribed by an authorized prescriber. In breastfeeding, then ibuprofen is actually safe because less ibuprofen is excreted into the breast milk. So moms that are breastfeeding can basically use ibuprofen. As I said, it's safer compared to other anti-inflammatories.